Hi, I'm Dr. Jeff Donatello, and I'm the clinic director here at the Center for Wellbeing in Portsmouth, New Hampshire. And if you're watching this, you've probably been struggling with your knees. More than likely you have osteoarthritis, and it's become very difficult for you to get around, or you see a future where that's the situation, where it's going to be harder to climb stairs, get in and out of cars. In short, your knees are in pain. So I want to discuss the alternative to the situation you may have found yourself in so far, because again, if you're watching this video, you're looking for a different alternative, because there's many ways to help your knees. The traditional way that most medical practices work is you go to your primary care, the doctor you know and trust, and they're looking to help you out, and you say, my knees hurt, they take an x-ray, and they say, yeah, we're gonna refer you to an orthopedist. The traditional orthopedist will say, well, we have inflammation, we have arthritis, we're not ready for surgery yet. Okay, let's try not to do that. Let's inject corticosteroids into the knee. So you've probably had cortisone injected in multiple times. Once you've had cortisone injected twice, then you may be lined up for surgery. And there's other things we can do to fill that gap. So one of them is using viscose supplementation, hyaluronic acid, also known as gel injections, where we inject gel into the knee. So some of you may have had that done. What we find in our medical office is that quite frequently, the offices that do cortisone and surgery, they do gel injections as an afterthought. So what they do is they're not trained properly, and they don't do it with ultrasound guidance. And it's super important to know exactly where you put that needle. And it's also more than one and done. It takes upwards of 3, sometimes 5 injections to really get a good coat of paint, so to speak, in that knee, so that that inflammation comes down, so that you have the proper cushion. So all this is covered by Medicare. It's just that we take the time in our office to make sure that our nurse practitioners are trained with the specific skills to help get you out of pain and not have to have you go down that line where you're getting ready for surgery. And that's another whole thing. That may be the proper way to go for some people, but many people don't want that. So if that's you, give our office a call and we can talk about different strategies. We can bring you in and actually do an ultrasound of your knee and see if this is something that would work for you and get you walking and get you back into enjoying life in the near future. I'm Dr. Jeff Donatello. I appreciate your time. Thank you.